There are a number of different ways of diagnosing Lynch syndrome, the first of which is to look at a family history. If you have 3 cases or more of bowel cancer in the family, of which 1 case was diagnosed under the age of 50, then Lynch syndrome is a real possibility. You should ask for a referral to see the genetics service in order to investigate this further. The other way of diagnosing Lynch syndrome is to look at the tumour of an individual who's had colorectal cancer. The mismatch repair genes in which faults cause Lynch syndrome produce proteins. It's possible to stain the tumour for those proteins, and if they are present, the assumption is that those genes are working and you've excluded Lynch syndrome. If one of the proteins is absent, it's suggestive that there may be a diagnosis of Lynch syndrome in the family. If you are unsure as to whether this has been done on your case, you should ask your oncologist or surgeon to see if it's been undertaken. If, however, you had colorectal cancer a number of years ago, or a family member had colorectal cancer a number of years ago, you should seek referral to a genetics department. If we've identified Lynch syndrome in a family, we will then be in a position to ensure that the patient gets the appropriate screening. Individuals who have Lynch syndrome should have colonoscopies, which are examinations of the lower bowel on an 18-monthly to 2-yearly basis from the age of 25. Women with Lynch syndrome also need to have the lining of their uterus inspected on an annual basis from the age of 35 using hysteroscopies. We know that Lynch syndrome is inherited, and therefore it's important that other members of the family are aware of this condition. If you are seen in the genetics service, they will be able to offer you advice and support through your diagnosis, and also discussions around the screening and how important it is to discuss this with the wider family.